As presented, signify by saying aye.
Aye.
Opposed, same sign. Okay, passed. Okay, we'll go on to number 4, the minutes of the prior Human Services Board meeting, which were sent out
For July 26th.
of July 26th.
So at your September meeting, I'll bring your regular August meeting minutes and the minutes from this meeting, and then we'll be caught up.
Any questions on the July 26th minutes? If not, I would look for an approval, motion to approve. Dora?
Yes.
Second?
Second.
Sally, seconded. Okay, well, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Carried. Go on to the Human Services Department budget for 2022.
So thank you for...
Proposal.
Yes, thank you for allowing me to have a meeting a little bit delayed where fiscal manager has left and was unable to do the budget. So getting this put together, I needed a little extra time. I could probably even used a little more today, but we got it done. And the budget that I have in front of you, I have 2 documents in front of you. I did not bring all the big stack of copies of all the individual budgets because I wanted to make sure you've got these documents. Those you never really asked for, and they have some formatting issues right now, so they don't look very pretty. So I apologize for that. They have to be into Paul's office by the end of the day, Thursday, I think. I think that's right. So we'll have those all into him. But this is a summary of what those documents are, and this is a summary this board usually looks at. So I'll start with the one that has the numbers because that's always the most interesting to everybody to start it out. So we have 2 funds in our department. We have the Human Services Fund, number 202, and we have the Senior Services Fund, Fund 203. And we have shown to you on this document what the levy is for 2021 and what we're proposing for 2022. There are some minor changes in between the units that we'll talk about in the second document that I've given you. But overall, there's a slight decrease in the Fund 202 and a slight increase in the Fund 203. However, there's still a net negative amount of $2,128. So we're proposing reducing our levy by just a hair over 1/10%. So the main reason for that is because of all that has happened in our department and all the attention that has been in our department the last few months. We felt that we had concerns if the public would support any kind of changes, so we're not making any big changes for 2022. We really didn't think we didn't want to create issues for the county board to have to justify that, and so we had to make some tough choices this year in this budget by keeping it as close to 0 as we could. So we actually came in just a hair under. So that's what the numbers tell you. The other document that's in front of you tells you the story of what's in this. Our total budget is right around $9 million. It's the highest the Human Services budget has been. The largest increase in all of that is the CCS program, and those funds come in. Those numbers aren't shown in the numbers I've given you because this is just the levy funds. The CCS program brings in an enormous amount, over $1 million a year in revenues to pay for the cost of the case management and for all the services delivered to individuals. So we have a pretty good budget this year, pretty sizable budget, but again, we're trying to work very hard to keep our levy just under $2.1 million. And that's, again, less than 25% of our total budget. As far as compensation, we have budgeted for the anticipated steps that staff would take. In our compensation, current compensation plan, every position has a grade, and each grade has steps. And each year, staff move up a step. So that's what we budgeted for. There's nothing in here for any aging the pay scale, as they call it, or a cost of living increase. There's also nothing in here for the compensation study. We were not asked to budget for that, but I just wanted to remind everybody, we've just budgeted for the pieces that we have. There's also no adjustments in here for health insurance. Those numbers I don't think have come out yet. And every year we do the budget, we don't budget for it, and then that's part of the budget process, is adding that piece in. Again, I think most of you know that, but I just, for the public, want to be really clear what is and isn't in this budget. So getting into the budget highlights of our overall budget. So let me back up. I realized I just made a mistake on this document here. Under the general information regarding the 2022 budget, that last line, it says levy covers. That should have been crossed off. That's from last year's budget. Doggone it. Sorry about that. So getting into the program highlights, obviously the COVID crisis changed how we do business for 2022 and 2021, and probably will in 2022. However, we did budget as though we were back in all of 2022 operating as if the COVID crisis has subsided, kind of how we were doing business in 2019, and our best guess what that might look like. So I do want to, and I think most departments are kind of doing that. One of the biggest areas in most of the units was a change in travel and training costs. Those were substantially lower because people weren't going anywhere. There was some training, but a lot of it was online, so it was a lot reduced cost. So we assume those costs will be going up as well. One of the things that we used that changed with the COVID crisis is the use of smartphones. We didn't have a lot of those out there to staff. A lot of staff have those so that they can do visits, visual visits with individuals if they needed to. So now staff are comfortable with using those devices. There's an increased cost to having those. We don't see taking those from staff. I don't think that would go well. But, you know, and that it's not the right direction in terms of use of technology. So we continue to see that cost a little bit higher than it has been in the past. In the Children and Families unit, we had a lot of kids in out-of-home care starting in 2015. We've been tracking that for you. It was up to about as high as 40. Now we're down closer to around the 25 range. However, we're not seeing a substantial decrease in those overall costs. The main reason being is that we have just a few children that we have in out-of-home care that have some really profound disabilities. And they are in placements that cost sometimes as high as $900 a day. We continue to work with those families, with the providers, to see if we can move those kids into a treatment foster home type setting. But again, these kids have very, very huge demands for their physical care and their care. So that's kind of hard to do. So that's the biggest driver right now. A lot of those kids, as they age too, the other issue is we think, well, as we get older, we know more about those kids, so we should be able to move them to less restrictive. But what happens, of course, is the hormones change in their bodies, and that really affects how their medications work for them, and their medications have much less effect, and their behaviors become much more pronounced. So we don't actually see those the behaviors improving many times. We're not the only county. We get emails monthly from other counties looking for placement for very, very hard to serve kids. There is work being done around the state for complex with the WTCO group, Wisconsin County Human Services Association. They actually have the behavioral health group. They have committees. They have the Behavioral Health Committee, the Children and Families Committee, and the Long-Term Care Committee, which I'm a chair of, working together and working with DHS and DCF to say, what can we do? Because more and more counties are seeing these kids with really complex needs, serious disabilities, serious amounts of trauma, all of that put together. We don't have any good answers right now, but we're continuing to work on that. So I just wanted to explain that to you. Does anybody have questions on that at all? There's a lot of information. Another area of our services that really changed during COVID was the senior meal programs. The congregate meal sites are closed for over a year, and of course the demand for the home delivered meals went up pretty substantially. We did end up getting contracts for the congregate meals, as has been discussed at this board, but we have fewer contracts with fewer sites than we have in the past. The ADRC Advisory Committee, Jeannie's a member, our ADRC staff, Melissa Youngbauer, they have a huge amount of energy of finding some really cool, innovative ways to deliver additional meal sites throughout the community, sometimes food trucks, things like that. So we don't have enough information to roll that out, but we do know that they're going to continue that. So we kind of anticipate that that budget will look, again, in terms of spending, more like 2019. The home delivered meal program we did budget for some increase. We think as people are getting back out in the community, the demand for home delivered meals will subside a little bit, excuse me. But we don't anticipate it's going to be everyone. We're also, one of the things that we've done in the past we haven't been able to do is we have to go into the homes and do regular assessments, at least annually, with the individuals getting the home delivered meals. And sometimes people have a need for it, but then if they're in rehab, but then they don't need it anymore because now after they had their hip surgery and they're doing better. So there may be people who don't need meals or as many meals dropped off per week. So we continue to be wise on how we use our resources that way. The other thing, of course, in the home delivered meal program is we struggle with finding enough drivers, and we're trying to get more volunteer drivers, but that has been a struggle as well. So we continue to say, if you know of anybody who'd be interested in volunteering, or we actually have an opening right now for a driver, we would love to hear from individuals that are interested. The behavioral health program, you'll see that there's a bit of an increase in levy there. As you know, we've expanded our services in the community with the CCS, CLTS, CSP program significantly. We are serving, again, we're bringing in over $1 million a year just in the CCS programs that we did several years ago. However, with COVID, we had people we have never heard of coming to us with mental health needs. Oftentimes we have crises in residential care for people that we see periodically, just like anybody with any other health condition. You do well for a while and then you start to struggle, and then you need to get some help till you can kind of get back on track. So that's, in the past, was kind of our pattern in terms of usage for those services, but now we are seeing people we've never heard of before, and some of them coming to us that are pretty mentally ill, pretty sick individuals, and having some huge demands for long-term care needs in terms of not just crisis, but long-term stability. So we've seen a big increase in that. Of course, with fewer local hospitals taking the crisis patients, we are sending more and more of them to Winnebago. Our Winnebago budget is, we had a budget a few years ago of around $80,000, and now we're budgeting close to $300,000 in this budget. Of course, the cost for that program continues to go up. 8 years ago, it was about $800 a night, and now it's $1,500 a night. The cost, of course, this cost does not include the sheriff's office having to transport people 3 hours one way. We were able to reduce some other costs in our budget, but not enough that we could cover the full cost of the increase for this and for increased residential care. So we did add some levy to that. The ADRC, the biggest change we're going to see there is we did budget for an increase in the rent. Our lease is up in January of 2022, so we did increase some of the rent costs. We are put a little bit finer point on the amount of time that staff how they claim their time that we can get reimbursed for it. So we continue to try to sharpen that up a little bit. But we did have to ask for a slight increase for the ADRC for the rent. We were hoping we could zero that out. The consultants that we've been talking about at our last few meetings, helping staff deal with the current crisis in the department, their work will be continuing into the first half of 2022. This is not going to be a quick fix. Healing takes a long time, and so there will be some costs for that, but that has been incorporated in this budget as well. The data system that we are implementing, We have now not just the annual licensing costs for that program, but we also added a document management program. So instead of just typing in the data of the individual served, we can scan in hospital bills, scan in medical records, scan in whatever it is, and add that to their files. And that program, we were able to purchase that program with COVID funding, but the annual maintenance cost of that we have to cover ourselves. We continue to prioritize staff training. We've been budgeting about 1.5% of wages. Someday I'd love to see that number get closer to 2%, but this made the most sense for us this year. The last 2 points are that our strategic plan will be expiring the end of 2021, so you'll be hearing about a new strategic plan soon. There's nothing in here for any of the new ideas that will come out of that strategic plan because obviously we don't know what they are. But we want you to be aware of that, how that could affect this budget. And the last piece is the no wrong door model. That continues. We continue to do work. Erica and her staff just last week were in Blair schools rolling out that model. Actually, she's got a super cool PowerPoint on it and really talking about how we're doing it, but how schools can do it and what schools can do to contribute to it. We're going to continue to work with our community partners to get them involved. And continue to work within our own staff in terms of how we implement this. It's a big shift for a lot of folks. It's a big idea, and so the implementation is incremental. I'm not always the most patient person with that, but it's the right way to do it. We didn't project any cost savings due to that model. We also didn't project any cost increase. What we really anticipate is that no wrong door model, what it's going to change is the quality of the service that we deliver. So I figured you might ask about that, so I put that in here. So that is the budget that we're bringing forward to you. And I'd be open to any questions or suggestions.
I have a quick question. Has the state made any movement on ADRC funding?
No, but that's a great point. Not just state funding for ADRC. The state budget, this past state budget that just was passed, had very little impact on our department. Didn't give us much money, but also didn't take away anything, didn't make any major shift on services, so that was good. As far as the ADRC, there was not, we were hoping for some increases on the ADRC funding. We did not see that in this budget. We continue to work again with the WTCO group. I think the effort for the increase in the ADRC funding, we got just a little bit behind the state process because it's really in April and May, the year before that the budget comes out, that you really need to have your proposal pretty solidly in the hands of folks at the state, and we were still massaging that. So we anticipate in this upcoming next state budget, which will start in a year from now, that we're going to be seeing some pretty sizable increases in ADRC funding. I don't expect Trempealeau County will see any of that money. I suspect that what will happen across the state, if that funding happens, is all other ADRCs will be funded at the level our ADRC is funded. For those of you who might be watching this on television, Trempealeau County was one of the first ADRCs in the state. And the individuals that did the work then were extremely wise people because the state said, tell us what you think it will cost to do this program, and they asked for a lot of money. And thank goodness, we, because of that, we are one of the highest paid ADRCs in the state. And so that's why we can really deliver some of the quality services that we can deliver. Our county and Jackson County, when you look at per capita, we are the best funded ADRCs in the state. And so it's very nice to be on that end of it versus the other end of it. But if there is any increase in funding, I don't think it will impact our county at all. There was talk again several years ago about taking the whole pot and reslicing it, which means there's winners and losers. And the WTCO group said to the state very clearly, we do not believe in setting up arrangements where there's losers. We can't take money from other counties. If there isn't enough funding, then we should be having a conversation about let's get adequate funding. And so that's what we're really doing. And folks, Tom Balsey, who's the top guy at the Orchid, and that stands for Office of something, I can't remember, but they do a lot of the work with the ADRC. They're really looking to our county and Jackson County because they were afraid we'd be saying we don't want to see any increases in ADRC funding because it's not going to do us any good. But we've been very vocal saying everybody should be able to do what we can do. No, no.
That kind of went to the wind.
Yeah, well,
I mean, because they made it as far as, I mean, we were really planning for the loss of funding, and then that just all shifted kind of strangely with the state, but it did, so.
Well,
I mean, I think Wichita had a big part of that, but it would,
I think the Human Services Wisconsin Counties Association was very much against that.
Yes, very much.
Be money taken away from counties.
Yep, winners and losers is not a popular thing when it comes to counties when we're working together. Any other questions?
Was shifting the diversion program, and how did that impact? Because I see the justice had a decrease. Is that reflecting the part that's no longer?
Actually, it's more reflecting a slight decrease in cost of some juvenile placements because we have the grant that's going to cover it, the community partnership, the youth diversion grant. The change in the diversion program, obviously we saw a reduction in revenues with that, but then we have, I mean, there's other things that we haven't, the management of the grant that we have, the state's expecting a lot out of us, and we really need to be putting more effort into that, because the other thing that's going to happen is at the end of 5 years, they're not going to give us any more money. We have to be talking about how we're going to make this program sustainable in terms of serving these kids early on, keeping them from re-entering the juvenile justice system. So there's an enormous amount of work that needs to be done around that, and so basically we'll be shifting the time from the diversion program to that. And I think that's going to, again, it really fits with the no wrong door model. It will deliver quality services and hopefully reduce the number of kids that are going to be needing care in the future. They'll need placements because of their juvenile behavior, and it's just a better service. So that's the main shift, but I'm glad you brought that up.
Any more questions on the budget?
This document I also give this document to exec finance when I go meet with them, because if I have to go line by line through the budget, I'd probably lose my mind. But I will add the point that Jeannie brought up about the ADRC, the state funding, and the diversion program in here, because they'll ask those same questions. So those are great additions. Thank you. We aren't looking to add any staff, and we're also not looking to decrease any staff. I think that's probably assumed, but I just want to make sure people hear that as well. We're not adding any staff. We don't have any project initiations that we're bringing forward. We're not adding any staff. We're not decreasing any staff.
Okay. If there aren't any other questions, I would look for a motion.
I'd make a motion to approve the 2022 human services budget.
Motion by
second it.
Jeannie to approve the 2022 human services budget proposal.
Second it.
Second by Sally.
Yep.
Okay. All those, I guess we can use a regular, we don't have to use a voice vote on, or roll call, rather. Just a voice vote. All those in favor signify by saying aye.
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 Opposed, same sign. Carried. Okay. Then I guess we move on to number 7, to go into closed session.
Make a motion to go into closed session pursuant to Wisconsin State Statute 19.85, Parent 1, Parent C, considering employment, performance evaluation, or investigation of an employee over which the board exercises responsibility.
I'll second.
Second by Jeannie. Okay. We'll go by roll call. Dora?
Yes, Georgine.
Sally?
Yes?
Rick? Yes. And Jeannie?
Yes.
And I'm yes. So we are now in closed session.